Hello everyone, my name is Amy Duff, currently a nursing student at Indiana State University. Today, the presentation I have for you is brought to you as a part of my community health nursing class. I'm going to take a look at professional nursing practice and patient care technologies, the electronic health record. This is something we'll encounter during the span of our nursing practice. So I want to take a look at some of the regulatory policies involved and entities involved related to healthcare records and how nurses can incorporate ethical handling of these records and interacting with these records that ultimately protect patients in the community. So starting off, let's look at the definition of the electronic healthcare record, which is basically a digital form of the paper healthcare record. It's often secure, instant access to people that are authorized to use it. That's huge. You have to be authorized to look at that information because it contains patients' medical history, all of those things listed here: medications, treatments, immunizations, lab results. This is sensitive personal information, and you have to be authorized in order to access this. The EHR streamlines and automates workflow for healthcare providers and allows for sharing between authorized providers. So think about sharing from your primary care physician to the local pharmacy or to a specialist that you're going to see. This is instant access rather than having to hold on to paper records. So next, let's take a look at the history, which is kind of fun to look at. 1600 to 3000 BC, the Egyptians had hieroglyphics, which indicated that there was some tracking of medical information and health records. In the 1900s to 1920s, however, paper medical records were more readily used. Skipping on to the 60s and 70s, advances in technology provided the foundation for the electronic health record. And looking at the early 80s and 90s, with the advances in technology, more powerful and more compact computer hardware available made it a little more appealing and a little more readily available to have health information on these electronic health records. And as you may know or may not know, electronic health records today are used across the board in healthcare settings. The transitions from paper records to everything electronic. So next, we're going to take a look at the benefits of electronic health records. So improve efficiencies and cost. Things are quick and easy to access. You can take a look at data from all over the place when it comes to the electronic health record, which improves care coordination. I could be sitting in one setting with another nurse or another doctor in another setting, and we could be coordinating patient care by accessing that same record, which improves outcomes and diagnostics. Kind of having it all contained in one area improves patient participation. Patients are able to access their healthcare record, and this keeps them active in their health management. So with benefits, there's usually always drawbacks. For nurses, one of those things is over-reliance on making clinical decisions. You need to still be active and present, and don't let the health record and the things that you input in there make the decisions for you. Sometimes inadequate training, the inability to access information sometimes plays a role. People need quality training in order to access all the resources available to them. Extra workload, sometimes the system is clunky, and another, goes back to inadequate training, and we don't want to cause extra work. Poor documentation, if things are pre-filled, click the box. Sometimes things don't get documented that really need to be. And then, of course, technology problems, the internet's not working, things like that is a barrier to accessing that health record. Ethical problems, what do I do with this information that I have, which could lead to legal implications for the patient? Safety is huge. Drawbacks to the electronic records going back to relying on the computer to make decisions for you leads to poor patient outcomes, increased safety risks, safety hazards, breach of patient privacy, inappropriate or inadequate care, and legal implications. So we want to keep our patients safe and promote good outcomes and ethically use the information in their health record for their benefit. HIPAA is a Health Insurance Portability and Accountability Act of 1996. It's a word that's thrown around the healthcare setting, and that is what it stands for. This created a set of national standards for the protection of sensitive health information. So, in essence, you have to be very careful what you do with somebody's personal information, down to simple conversations out and about in public. You can't talk about specific patient things and related to their health care, and their electronic health record applies to everybody, healthcare providers. I want to mention business associates, people using that patient data for healthcare related services and information. So as far as regulation and policy, there's people that are involved in this. The Office of the National Coordinator for Health Information Technology on healthit.gov is kind of at the forefront of our federal healthcare related IT efforts. It's a resource for the entire system, and it's to promote good use of the electronic health record. So this Health Information or Technology Economic Act, so that was something that was enacted, and the goal was to promote and expand adoption of health information technology and the use of electronic health records. So this is something that is important to improve efficiency, care coordination, all of those benefits I spoke about. The Department of Health and Human Services is one of the authorities and regulating bodies, and have established programs for regulating healthcare information, healthcare technology, including electronic health records. So there's a certification program, and just under that, Medicare and Medicaid have incentive payments for people that transition to the electronic healthcare record. And then finally, the meaningful use or interoperability is kind of a promotion with the goal to promote appropriate use of people's healthcare information. So there's so many entities involved in regulation, policy, laws about healthcare information, and these are just a few of kind of what drives that. So as far as nursing implications and our responsibility of nurses, if from the very beginning as students to the late season of our career, we do have responsibilities when it comes to using the electronic healthcare technology in our clinical practice. And looking at this as far as one specific area of nursing that uses this information is nurse informatics. It was established in 1992, and this is basically the integration of nursing science with analytical and information sciences, and to change nursing outcomes, as it says on the bottom, promotion of health for our families and communities. So that's one specific area where nurses use that electronic record in a very defined role. And so looking at our responsibilities as every day, whether or not you're in the informatics specialty, is to maintain patient advocacy and trust. We want our patients to know that their health information is private, where you can access their records, but they need to trust us with that information. Providing our patients accurate information, making them aware of the HIPAA policy and how it works with the relation to their healthcare information and how their information is going to be used. They need to know they have a right to access their health information. That's their personal record, so they need to know how they can get to that, and also how their healthcare information is going to be used They need to know that their healthcare information is protected, and then we need to make our patients aware that they have the right to make their healthcare decisions based on the fact that they're getting accurate information. So here are all the resources that I used in today's presentation. Hopefully this provided you with an overview of the electronic health record and how it applies to nursing. Thank you.